And welcome back, everybody. Thanks for sticking with us. Dr. Robert Myers is our guest. We're talking, he's the director of the Kelberman Center. We're talking about autism. Where did you get your doctorate?
I got my PhD at Syracuse University.
Okay. Did you go to undergraduate school there as well?
No, my undergrad is actually from Temple in Philadelphia. I went to Temple for undergrad, then a master's degree out in the Midwest, 2 master's degrees at SU, and a PhD at SU.
So you went to at least 2 good basketball schools.
You know, I was back in the days of John Chaney at Temple. I don't know if you remember him. Heck of a coach. Loved Temple basketball. Still love Temple basketball.
Yeah. The Kelberman Center, do they have, and I know your wife is also affiliated with Syracuse, yes?
Yep, my wife is a professor at Syracuse University and is also a director of special projects at the Kelberman Center.
And with your links to SU, do we have any programs from the Kelberman Center going on up at SU?
We do. We have a partnership with Syracuse University called Inclusive U, which is an SU-hosted program. It's the largest continuing education program for people with developmental disabilities to attend college in the country. We have 60 students with autism and intellectual and developmental disabilities at SU. They're fully integrated in all parts of campus, take classes, live in the dorm. Really phenomenal opportunity for them to learn complete independent living skills on a college campus, and then graduate and take jobs in the community.
What about Utica College? Anything there?
A similar project at Utica College. In partnership with Dr. Casamento and her team, we have about 15 students with autism who go to Utica College, take place in many different internships. So they're working across campus in everything from facilities to athletics to admissions, and all those business offices partner with our team to figure out how to customize internships for people with autism. And you know, both these programs show the shining achievement is that our people with autism graduate with a resume that they can then take to employers. And you know, a lot of people with autism don't necessarily interview particularly well as part of that core social skills issue. But for employers seeing, wow, you worked at Utica College in the admissions office processing all these applicants, and on their resume they have people they can call on as references. So having a resume, having references, having real life experience makes all the world of the difference. You know, we're able to help people through the interviewing process and then ultimately get them jobs. And it starts with these projects like the one at SU and the one at Utica College.
We talked about your new clinic, so we better talk about it some more. When did this start?
This has been many years in the making, but officially opens this summer. We're going to open a new applied behavior analysis, or ABA, clinic here in Utica and also in Syracuse.
Will this be on Genesee Street, or will this be over at the UCP?
Most likely on Genesee Street. We're finalizing some leases now to kind of, as we grow, we have to shift some people. Looking to do that on Genesee Street, and what it will mean for families is that as soon as somebody's diagnosed, we're then able to provide them applied behavior analysis services, which New York State Department of Health and the federal CDC have both recommended as the thing that families need to do for their young children. Of course, we can also do it through our preschool, but it takes a little more time to get into our preschool program. Or maybe you're interested, or the family's interested in a different preschool program. We can then combine our ABA services with other preschools. We can do it after preschool. We can do it after school for school-age kids, or we can create full-time clinical programs for young people. So it's going to give us a whole new venue to really partner with families and get to that clinically significant level of intervention, which is 15 to 20 hours a week of ABA.
You know, whenever you come on, I think about this. I think about the people who were born too early and who never had even a diagnosis, let alone any help in life.
Yeah, you know, the long-term outcomes between people, in the cohort studies anyway, between people who have effective early intervention and no intervention are pretty significant. It makes a massive difference.
Yeah.
And you know, we talk about folks with intellectual disabilities working in competitive employment, you know, in jobs like here in the studio, and one of the differences is getting that early intervention, right? Because early intervention gets people ready for school, gets them more successful through school, and ultimately can be the difference between long-term employment and long-term care.
You know, one of the things that I haven't seen in a while, but one of the things that I used to see on sports announcers was football sports announcers, I think. They were wearing a lapel pin that was like a piece of a jigsaw puzzle, yes?
Yep. And you'll see that during the tournament, the NCAA tournament. Many of the coaches and the announcers will wear that lapel pin.
Mm-hmm. And that's
for Autism Awareness Month as we come into it.
And why a piece of a jigsaw puzzle?
Well, because autism is seen as a puzzle. It's a mystery. We don't really fully understand the underlying biological differences, and there's still a lot to work out in terms of the long-term support and care for people. So the puzzle piece has been the symbol of autism since the mid-1990s.
The walks that you've got coming up, and you can look at your sheet, because I don't expect you to remember those dates, but remind everybody where they're going to be.
Okay, so they can register on our website. They can register the day of the event.
Give the website.
Kelbermancenter.org, KELBERMANCENTER. And we're on April 6th up in Boonville at the VFW, April 13th at Hamilton College, April 27th in Oneida at the high school. Same day, the 27th in Cooperstown at Glimmerglass State Park, and on the 4th at May 4th rather, at SUNY Poly for our big walk. That's a big event and has many, many, many people.
What do you think will be the turnout up there this year?
Oh, I bet we'll crest 1,000.
Really?
Yeah, I think I can say that we're the second largest walk in the Mohawk Valley.
And is this going on around the country, these autism walks, or is that singular to us?
There are walks that take place around the country. They're not part of the Kelberman Center, but they're part of either other organizations or Autism Speaks, the national organization.
We've only got a few seconds left, but in addition to this fundraiser for the walks, what other fundraisers do you do during the year, Rob?
We do a fitness-related event each summer, and we partner with other community events. So, for example, last year we were part of the Mayor's Gala.
That's right, yeah.
And have a number of smaller events that are hosted in businesses across the area.
The Mayor's Gala was a big success for you, and I forget who you partnered with. There was 2 people last year, right?
It was just us, and it was the
Okay.
biggest turnout and fundraiser that they've ever had as part of the Mayor's Gala.
Oh, that's great. Good. Come back again. You don't have to wait till a national week. Come back and see us soon.
Okay. Thanks,
Okay,
Jim.
that's going to do it this week for us, but we'll be back next week. Don't forget CNYhomepage.com. Lots of good stuff there. Until next time, take care of yourself, everybody.